Who here has back pain issues?
Me.
Well, if you're like many Americans, back pain is a growing issue. I personally have been dealing with back pain from degenerative disc disease for about 8 years now. In these next few minutes, we'll go over what degenerative disc disease actually is, what the main causes are, and some of the treatments available. So to begin, let's take a look at the spinal column. As Dr. Sunil Sabharwal, it's a lot of weird names I can't pronounce very well in this speech, states in his book titled The Essentials of Spinal Cord Medicine, there are 5 segments to the spinal column. Starting at the top, you have the cervical, then the thoracic, followed by the lumbar, sacral, and coccygeal. In between each vertebrae, you have a disc. The disc, as explained on Cedars-Sinai's website, cedarsinai.org, is comprised of a firm, tough outer layer known as the annulus fibrosus, as well as a jelly-like core, which is called the nucleus pulposus. Dr. Fabio Galbusera and his colleagues, in their paper titled Aging and Degenerative Changes in the Intervertebral Disc and Their Impact on Spinal Flexibility, say that one 5 times fast, state that the fibrocartilaginous makeup of the disc allows it to take a lot of impact and absorption when it's healthy and before it gets damaged. With an understanding of the basic mechanism of the spinal cord, we'll move on to the main causes of degenerative disc. As Dr. Brian J. McHugh on the website spinehealth.com states, the main cause, the overall cause of degenerative disc is simply wear and tear on the intervertebral disc. As you can see in this slide here, those top 2 discs are nice, thick, healthy, and the bottom 2 are just worn out, barely even existent, and that's where all your pain is going to be coming from. Degenerative disc is essentially a chronic low-level pain that has flare-ups of extreme pain that can be debilitating at its worst. The cervical and lumbar segments of your spinal column are where you're going to be most prone because they absorb most of the impact and movement from your entire column. Cedars-Sinai also states that another main cause of degenerative disc is the disc dries out over time, losing a great percentage of its water content and its elasticity, so it can no longer take all of that compression and the wear and tear. And finally, the third most common cause is simply daily activity, sports injuries, other just injuries and insults that occurs from daily life. And now that you're a little more familiar with the overall condition, let's go on to the main treatments. Most treatment starts off conservatively, just pain medications, physical therapy, certain stretches and exercises, and chiropractic care. Chiropractic care has become a very prominent treatment source, and it's been very promising in its reliability in easing the pain. Dr. Stephen Shirshani, who is a chiropractor, and an article in the newspaper PR Newswire, said that a study he did with certain treatments and technological advancements in the chiropractic field had not only increased disc height in patients, but also had a corresponding decrease of pain in the lumbar and cervical regions. If none of those take care of it for you, if medicines, exercise, and chiropractic can't help you out, surgery is a last resort. The most common surgery is a spinal fusion, and that's explained by Dr. Sergei Kuchiev in the paper The ABCs of the Degenerative Spine. The spinal fusion is simply like it sounds. They go in and fuse 2 vertebrae together, which is manually holds the disc space open so the 2 vertebrae don't make contact and cause that pain. The other common surgical intervention is an artificial disc replacement, which as that sounds, they go in and scrape out all the deteriorated and injured disc and replace it with an artificial one. Kind of cut and dry on that. To wrap it up, the spinal discs are the shock absorbing pads in between your vertebrae. Degenerative disc is the wear and tear due to age or injury of that disc space. And medicine, stretching, chiropractics, and surgery are your common treatments, not necessarily curative treatments for the condition. Last but not least, remember to lift with your legs and not with your backs. Thank you for your time.